All right, good morning. We are students from the Dental Assisting Program here at Columbia College. We've prepared a short presentation for you just about oral health and home care. My name's Camille.
My name's Nicole.
My name's Morgan. I'm Jasmine.
I'm Sue.
I'm Leanne.
I'm Carmi.
All right, so I'm going to start by talking about your gums. Many people think about oral health and only consider cavities and how white their teeth are, but your gums are just as important as your teeth. The early stages of gum disease is commonly referred to as gingivitis, which is simply described as inflammation of the gums. This is when bacteria build up, causing the gums to become inflamed and to bleed easily when brushing and flossing. Gingivitis can be caused by hormonal changes, illnesses, bad habits such as smoking, poor oral hygiene, or a family history of dental disease. Some signs of gingivitis include gums that bleed during and after brushing and flossing, red, swollen, or tender gums, persistent bad breath or bad taste in your mouth, formation of deep pockets between your teeth and gums, loose or shifting teeth as well. Only a dentist or periodontist can diagnose and determine the progression of gum disease. Gingivitis is reversible, however, if it progresses into periodontal disease, it becomes a more serious and irreversible problem.
So what is periodontal disease? Periodontal disease is an inflammation disease that affects hard and soft tissue, so that's basically the gums and the bones that hold your teeth together. There are two types. There is gingivitis, which is reversible, and periodontitis, which is irreversible. Thank you. So there are 7 stages to periodontal disease, and the first one is acquired pellicle. And that is a thin film of protein that quickly forms on teeth. If not brushed up, becomes plaque. And plaque is a soft mass of bacterial deposits that cover the tooth surface. It can be brushed off, but if it is left over time, it turns into calculus, which is caused by plaque buildup that is hardened by calcium and phosphate salts in saliva. It must be scaled off. If left on, it can irritate the gums, which causes gingivitis. And gingivitis is an inflammation of gums, most common human disease, and is the easiest to treat and control. Symptoms are redness, swelling, and bleeding. And if that isn't treated, it turns into periodontitis, which is the inflammation of supporting tissues of the teeth. At this point, it is irreversible. Gums separate from the tooth as bacteria forms inside. As that disease progresses, it becomes bone loss, and as you can see over here, the bones are supposed to be here, but the bones have recessed all the way down here, exposing the root. And as the bone loss progresses, teeth start to fall out, and unfortunately, teeth do not grow back.
Okay, so as I said before, gingivitis can be reversed in most cases when proper plaque control is practiced. Proper plaque control consists of professional cleanings twice a year, as well as brushing and flossing daily. Twice a day is preferred. Brushing will eliminate plaque from the visible surfaces of the teeth, and flossing removes it from in between the teeth and under the gum line. Brushing after meals will remove food debris and plaque that get trapped. Always brush your tongue, the roof of your mouth, and also your cheeks, because bacteria loves to hide there. Using mouthwash in addition to brushing and flossing can also reduce food debris left behind after eating. Make sure you have a clear understanding of your risk for gum disease. Age, smoking, diet, and genetics can increase your risk. If you can keep up with these methods, you should be able to minimize and even prevent gum disease.
Okay, so I'm going to talk to you about preventing dental decay. Dental decay is the destruction of the enamel of your teeth, which is the hard outer white layer that you see in your mouth. Decay is often referred to as a cavity, and cavities form when there's 4 things present. Our teeth must be present. It takes time. It will not happen overnight. And 2 main factors are bacteria and sugar. Bacteria is in our mouth, commonly found in plaque, and sugar is found in the foods that are high in sugar and carbohydrates. When bacteria and sugar mix together, they create an acid, and this acid will attack your teeth, causing the decay and the cavities, which can lead to pain. The good news is that you can stop the production of the acid in your mouth by drinking water after you eat, or chewing sugarless gum, or brushing after eating. So when you chew sugarless gum, it activates the saliva in your mouth, which will help protect your teeth. Brushing and flossing will clean away any food, sugars, and acid, as well as drinking water will wash it away as well.
Okay, so now I'm going to talk about benefits and sources of fluoride. So fluoride is a mineral that's found in all water sources. Fluoride helps the enamel in the tooth remineralize, and it helps strengthen the tooth. So this effect is important because it prevents and reverses the early signs of decay. So there's two types of fluoride. There's topical and systemic. Topical strengthens the teeth already in the mouth, whereas systemic fluoride is ingested into the body and become incorporated into forming tooth structures. So topical fluoride is found in mouth rinses, toothpaste, and treatments you can get at the dentist. And systemic fluoride can be found in tablets and drops. So now I'm going to show you guys how to brush. So the first method I'm going to be talking about is modified bass. So that's when there is no recession present, and what recession is when there's any part of the root that's exposed. So come at a 45-degree angle at the gums, and then brush up. So the next method is the modified Stillman's. That's when there is recession present. So you're going to want to start at the gums and then brush up. The next method is Charter's method, and that's for anyone with braces. So close the bracket. So you want to come at a 45-degree angle into the bracket and brush around it. And then the next method is Bones method, which is for kids or people with low dexterity. So this one is just circular motions around the teeth. Okay, and now, like Camille said, you're going to want to brush the tongue, and the roof of your mouth, and your cheeks. And you're also going to want to brush the backside of your teeth as well. Okay. Now I'm going to show you guys how to floss. So obviously you're going to want to get a smaller piece of floss, but you're just going to want to wrap it around your middle fingers like this, and then take your pointer fingers, and that's what's going to help glide the floss through. So you just want to come through the teeth, wrap it around like a C, wrap it around like a C, and then you can take it out. And then you just want to do that with every tooth.
Okay, so I'm just going to be talking about the benefits of regular dental exams and cleanings. So, regular dental visits are important. They help keep your teeth and gums healthy. Regular visits help prevent cavities by teaching you how to maintain good oral health. Checkups catch early signs of tooth decay, which can save your teeth. They'll be checking for cavities, plaque, tartar, calculus. They'll also be checking your gums, tongue, throat, head, and neck for signs of trouble, swelling, possibly cancer. Regular dental checkups include exams where they examine your gums for signs of gum disease, check for loose teeth, examine your tongue, look for visual signs of cavities or tooth decay, check for broken teeth, and evaluate dental appliances like braces, and take x-rays. Your gums are measured with a special tool to measure the spaces between your teeth and your gums. So when your teeth are healthy, the gums or the space is shallow, and then when your teeth aren't healthy, the space is deep. Tartar and calculus is also removed by hygienists, you can't remove it at home. And then your teeth are polished, which removes surface stains. And it's good to have dental visits twice a year to learn some tips to improve your brushing techniques or styles and prevent cavities with brushing and flossing and keep your teeth and gums healthy.
Now we're just going to take a minute to talk about the benefits of proper nutrition. It's important to get all the vitamins and minerals
in daily because it all plays an important role in the health of your teeth and gums. So you need your vitamin A and D and your C, B, K, E. Those are good for bone development and tissue health and healing and things like that. And as far as your minerals go, you need calcium, magnesium, phosphorus, and fluorine. That's good for bone and teeth formation as well. And you don't want to forget water. Water is a significant component of saliva, and it will help remineralize your teeth. So you need to drink enough water. And to help you do this, there's the Canada Food Guide. And it's just a simple table that sets out how much you should be eating for your age group and how many servings of what food.
Okay, so I'm going to be talking to you about the effects of tobacco use. So it can cause gum disease, and gum disease is an infection of the gums, and it can affect the bone structure that supports the teeth. In severe cases, it can make your teeth fall out. Smoking also weakens your immune system, making it harder to fight off the gum disease once you do have it. It can also cause oral cancer, so smokers have a higher risk of oral cancer, and the risk also becomes higher the more you smoke. The toxic elements of smoking causes harm to cells, which can lead to oral cancer. It also results in hairy tongue, which is that, and it's an overgrowth of little hairs on the tongue known as papilla. And with tobacco use, the color is generally brown or black, and it can also lead to bad breath. It also causes stomatitis, which is smoker's palate, and it's seen in the mouth as a number of bumps, which may have red centers and occurs at the top of the mouth, and it's due to irritated salivary glands with inflamed ducts. This can go away if someone stops smoking, and it usually takes 1 to 2 weeks after you stop smoking, then it completely goes away. So other effects of smoking would be discoloration of teeth, fillings, and dentures, and it also causes you to have a higher risk of cavities, along with causing bad breath, and it affects the ability to smell and taste.
And that concludes our presentation. Thank you very much for listening to us.